thank you for joining today's virtual education program with Cancer Support Community Los Angeles. I'm Larissa Montalvo, and I welcome you to this week's webinar titled Swipe Right, Dating After Cancer. Today, we're joined by Julia Leavitt and Madeline Elia, licensed clinical social workers at UCLA, to discuss the normal challenges that come with dating after cancer. Our speakers will provide some guidance and interventions and leave you with insight as you reflect on the prospect of getting back out into the dating world. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at www.cancersupportla.org. Before I introduce today's speakers, please note that we cannot see or hear you. Your video and microphone are automatically disabled for this webinar. We will not be monitoring the chat room, but you may enter your questions into the Q&A feature at any time. Questions will be answered at the end of the presentation. We may not be able to get to all of your questions today, but our presenters are invited to share their contact information at the end of the presentation. Without further ado, I would like to welcome today's speakers. Madeline Elia is a clinical social worker at the Simsman Center for Integrative Oncology at UCLA. She provides direct support to patients and families who are experiencing the many challenges that come with a cancer diagnosis. Much of her work focuses on the unique needs of young adults with active cancer diagnoses or who are in survivorship. Joining Madeline today is Julia Leavitt, a licensed clinical social worker and psycho-oncology board-certified specialist who serves as the program manager for the UCLA Adolescent and Young Adult Cancer Program. For over a decade, Julia has worked in primary medical settings, including New York University Hospital and Mount Sinai Medical Center. Upon returning to her Los Angeles roots, Julia joined a group of psychotherapists at the Samuel Ocean Cancer Center at Cedars-Sinai. It was there that she provided therapy to children and adults facing active cancer diagnoses and developed the extensive firsthand knowledge and skill set needed to support this unique needs of AYA patients. Welcome, Julia and Madeline.
Hi.
Hello, thank you for having us.
We're so grateful to have you today. Thank you for being here with us. The floor is all yours.
Well, thank you for having Maddie and I here today. We're both really honored to be here. And by no means are we dating experts. We come sharing knowledge from our patients of what we support them with these everyday challenges that come with dating after cancer. And just to normalize that dating is a very individual experience. It's putting your best version of yourself out there. You have to be vulnerable, confront some of your own fears. And so what does that look like after a cancer experience or why you're on a cancer journey? So that's what we're here to talk about today. And we're excited to be here. And as Larissa shared, we welcome any questions, but we have carved out time at the end of our presentation for that. So we found this quote, and we thought it was really timely and perfect to start our presentation with, and we hope that you'll reflect on it as we share today. Love yourself in the things you love, for that is where you will find yourself too. And it's by Fiona Childs. So to get started today, because you'll hear us talk about how important humor is in this experience, what does dating even mean? So when we were putting this together and we looked in the Merriam-Webster dictionary, dating is defined as a person with whom one has a usual romantic date, like bringing a date to a dance. I don't know how many people use that, so maybe that's a bit outdated, no pun intended. And then when we looked at the Urban Dictionary as they define dating, the process by which you decide whether you hate the other person or not. So we leave it with you, whichever definition resonates the most as you think about dating in your life, pre-cancer, and as you're exploring dating now, post-cancer. I'm gonna turn it over to Maddie.
Yeah, so today we're going to hit a few topics. The three kind of main things that we want to touch on in our talk today are, first, addressing common questions and fears about dating. With our patients, Julia and I kind of really hear a lot of the same concerns and the same worries when our patients are getting back into dating after cancer or even during, their treatment. So we're going to hit on some of those. We're going to talk about some specific health and intimacy issues that may come up while dating, right? Specifically around kind of sexual intimacy and things that may have changed because of your treatment or because of your health overall. And then we're going to leave you with some specific tools to help you feel confident while dating. So some of these tools are going to be focused on how to talk with a new partner or how to talk with a date about your cancer experience and some of these concerns that may have come up for you. And also specific tools that are really geared more towards your own kind of personal individual work that you can do to help you feel more confident as you start dating again.
Sorry about that. Okay. So dating, what do we know? In the best of times, we know dating can be a challenge. For many of us, it evokes a range of emotional responses that aren't always easy to sit with and digest. So when we think of dating, a lot of different feelings and emotions come to mind, I think, for all of us. Sometimes we might think of all these hangups from past dating experiences that we're stuck on, and how do we get past that? Other times we may be fixated on a goal, such as, does dating lead to marriage? And what does that look like now in this context of where am I with my cancer journey? And what will that mean in finding that partner and partnership? And for some, dating was a really fun experience prior to cancer. And how do I continue to explore dating as something that's fun? For others, dating is a challenge. Having to put yourself out there, be vulnerable. It can be very intimidating to have to explore yourself with someone else. So there's a lot of fear around dating. It brings up this idea of, could I be rejected when I'm meeting someone new? And what will that look like for myself? How will I feel? About dating pre-cancer came with that. Now, am I going to be rejected based on the fact because I had cancer, or what I did disclose, what I didn't disclose? For sometimes just hearing that getting ready for a date can bring up butterflies when we're starting to just talk with someone. This idea of looking for love and what that means, this emotional intimacy with someone, joy. Other times we may be in a place where we just want to avoid dating altogether because of all of the above. And also looking at this as a time of growth. Where are we? Are we in a place where we're working on ourselves? Are we ready to grow with someone else and invite them into our life and be on that journey together? So I put all of that out there to think about and to normalize that these are all appropriate and healthy emotions and feelings to be experienced when we start to think about dating. So there's no right way to date. And as I said earlier, Maddie and I are not experts, but here are some things that I think we want you to start to think about as you're getting ready to think about dating in the context of having a cancer diagnosis. And so why not look at this as dating 2.0? So taking what you know about dating or the experiences you had pre-cancer self and dating, or maybe that you didn't have, and putting that together as you think about what you want your dating to look like now. So it's a time to really pause and get very comfortable with yourself as you date. And dating looks different for everyone and will look different post-cancer, and that's fair. And it's an individual experience, but this is a time where you get to ask yourself and be very selfish, what do I want when it comes to dating right now? And really do a full body scan of that from head to toe. And who am I today versus who I was pre-dating? What characteristics of myself and that person and a partner that I was looking for pre-cancer do I want to carry into this new dating version and take control of? Maybe there were things I loved about my old self when I was dating that I want to continue with. Maybe there are things that aren't going to work anymore. How has cancer changed the way I look? We know dating is scary. It's scary enough, but now with cancer in the picture, that's a whole new level of scary. We'll normalize that. And it can cause extra unanticipated challenge. Some people that we work with worry more about the self-disclosure, and Maddie's gonna really go into that and talk about some great tools and interventions to use. Others worry more about when is the right time to get out there and share my cancer diagnosis and history. And it's all very individual. And I preface all this because this is really just laying the groundwork and making sure that you are comfortable with who you are right now and getting out there. And there is no right answer. It is a very individual experience. Some people are upfront about it, putting it on their Tinder profiles, and others wait till they feel an intimate connection with someone. So back to this 2.0 version of dating and thinking about what do I want from dating. Here are some questions that Maddie and I find can be really helpful as you're starting this process. So am I ready to commit to something right now? Is this really what I want after months or years of being in treatment and I'm now back in school, or I'm working full time, or I'm able to say yes to plans with my social connections and not have to say no? Is this what I want right now? Is this what kind of level of commitment am I looking for? Which falls into what kind of a relationship am I looking for? Have I thought about that? Am I looking for something casual or more serious? Or am I not sure, which is okay too? What would my level of commitment be based on those things? And then this is a really important question to ask yourself. Am I ready to open up to someone new? Do I feel safe to branch out of my current social supports and social squad and support team that has been getting me through the past several months, and share this new part of my life with? Maybe you've been practicing in other settings, which we highly encourage, in the workplace, in school, through, maybe you participate in a support group through cancer, and that is new friends. And so maybe this is a way where you practice and get support from. Have you shared your history of cancer with other new people? Similarly, in the workplace, with family friends that are new or in new environments. So you have a test run to do this. Have you thought about how, if you were in a committed relationship with a potential partner, how you would want to share this history? Have you visualized how you would share this information? By doing all this is allowing you to have control in a situation where you may feel vulnerable, may feel triggered, may feel like your self-confidence is going to be lowered, you might be judged, you might be rejected, all the things that come with dating that could be challenged in this situation. What does this look like for you? So I ask you to pause and think about these things as we continue throughout this presentation today, only to support you and help you be the best version of yourself as you continue on this dating journey. So you and dating, we're talking a lot about yourself today. Love yourself first is the most important thing. Regardless of what you're looking for, a cancer experience can change your feelings around dating. You may feel out of practice when it comes to dating and perhaps has lowered your self-confidence. But by laying out the groundwork and preparing yourself is only going to set you up for success. And so that's why these previous slides that we presented today are here to help you to really think about what you want from this next experience in dating. And allowing you to be in control and the captain of this experience. And so I'm going to turn it over now to Maddie, who's going to go into more of some interventions and how-tos.
Yeah, so Julia did a really good job of kind of laying the groundwork for thinking about how you might know if you're ready to start dating again, right? And really good questions to ask yourself to kind of figure out what your level of readiness is. And like she said, it's okay if you don't know what you're ready for. It's okay if you don't really even know what you want. But if you've kind of taken the leap, and I think you're here today because there's some interest in dating after cancer, right? Then this is kind of the next phase of questions that we're going to go over. So Julia and I hear a lot of the same questions and concerns from patients, and we thought that it would be good to really highlight and normalize a few of the big ones and really kind of talk through them today. So the first one is, how and when do I share my experience with cancer? This is a big one. And in fact, I think this one stops people from getting out there and dating again because they're just unsure of how am I supposed to talk about this huge thing that has happened to me in my life with someone new, especially if this is your first time starting to date again after having gone through cancer. The second thing is asking yourself, have my needs around physical and sexual intimacy changed, right? So, the kind of big common thing that we talk about is a good example is with breast cancer patients. If you're on hormone therapy, for example, and that's changed certain things about your sexual health, that might be something that is a concern for you and that you're not so sure about how to talk about that with a partner. So we're going to go over that too. And then the last thing, which I'm actually going to address first, is this question of, will people even want to date someone who's had cancer? And I can give you a definitive answer, yes, because there was a research study done in Europe recently that addressed this very question. And they looked at, they took participants, I think they took a group of college students and set up, a kind of a fake dating website for people with fake profiles. So people who either hadn't had cancer ever in their life or people who had. And they found that there was no difference in preference among people looking for dates regarding their cancer history. So people really didn't care if their potential partner or their date had ever had cancer. And a really interesting piece of this study, which I think it's not necessarily indicative of what you choose to do, but they did find that a lot of participants said that they preferred to hear about their partner's cancer history after a few dates. So after they've gotten to know them a little bit was when they preferred to hear about it. So not before or on the first date. Now, that might be different for you. You might feel more comfortable sharing right off the bat, like even in your profile, like your dating profile, if you're dating online or on the first date. But it's certainly up to you what you decide, and we're going to kind of go over how to bring that up. So, how to talk about cancer with a potential partner. Sharing about your cancer experience can feel really scary because this is a really intimate piece of your life, right? And especially if this is something that you have recently experienced, or if you're still experiencing, you're still going through some form of treatment, it can feel like a lot to share this with somebody. But at the same time, because it is something so intimate and personal, it can really help you build trust with that person and it kind of help facilitate some connectedness and some closeness with them. So we want to talk about doing things that can help you feel the most comfortable talking about this with a new date. The very first thing that we want to highlight is think about, how do you talk about cancer with the people that you do trust in your life, the people who are familiar to you? How do you talk about this experience with your friends, with your family, even as Julia said, like with your coworkers or with students in your class, right, if you're in school? And that can be kind of a good framework for you to think about, well, that gives you a picture of how you talk about cancer is how you're starting to integrate this as a part of your narrative and your life story. And in fact, we also encourage you, if you're not already, to connect with a therapist too, because a lot of the work that we do with our patients is helping you integrate this experience into your life narrative, right? And having a good sense of that can really help you feel confident when it comes to sharing with people, especially new people in your life. So a simple share, as you can see on the slide, is really simply just a simple share, what it sounds like. So talking with somebody about, what your diagnosis was or is, what treatment was or is, and just kind of the basics of what you want them to know about this piece of your life. What is the most important for you to convey to this new partner? What's the most important for them to understand about you? It might be useful to show scars or physical changes, kind of a show and tell, right? And of course, this is going to be very individualized and very personal to you. If let's say you've had a physical change like an amputation, something that's very apparent and obvious, that might be something that you feel really comfortable sharing right away in your profile. And that might, like if you're dating online and you have a dating profile, you show a picture, you put a little caption and you explain that, and that could really even kind of help you feel like you're breaking the ice with someone, so to speak, by sharing it that way. Or you might choose not to show scars at all. Maybe they're in more intimate places, right? So maybe that doesn't come up until later. We do encourage you to use humor. Of course, like when it comes to talking about serious things in life, especially with new people, whether or not it's cancer, right? It could be something else that you're talking about with a new person. Using humor can be really helpful. It can help alleviate some tension. It can help the other person feel comfortable when you're talking about something so serious. But what we've like the little asterisks next to humor in my book would be really be mindful of how you're using it. Right? So if you're finding yourself using humor in such a way that you're minimizing your own experience, you're kind of brushing off something that is actually very important to you and very serious for you, something that you really want to convey to your partner as sensitive, you don't want to use humor in a way that's going to do that, right? So really be thoughtful about that. Really consider how, if you're joking around about this, that it could send the wrong message to your date or to your partner. And then finally, we encourage you, like I said in the very beginning, practice with a friend. Like use your friends or the people in your life who you trust to talk about this first. Even talk about this with your therapist if you have one too. So I came up with a couple of examples just to kind of highlight the way that, talking about your cancer experiences can look. These are two completely made up patients, two completely made up people. I just wanted to kind of highlight two different ways that this can look. So the first one, Amira, we'll say she's 27, so in her later 20s. Let's say she's gone through treatment for the last year. She's done with treatment. She's in survivorship, and she's starting to think about getting back into the dating world. She's not really sure what she's looking for. She's just kind of wanting to get her feet wet in the dating pool. Maybe she's not looking for something so serious, but is really kind of focused on getting back out there and figuring out how to talk about this huge thing that has just happened in her life for the last year with a new person. So she's very nervous about sharing about her cancer experience. It's rooted in a lot of fear of rejection and judgment. And so as a result, she finds that the best way for her to talk about it, just for her to alleviate some of that fear of judgment, is to use humor, right? So she's not doing it, let's say, in a way where she's minimizing her experience. She's still able to talk about it in a way that is serious and sensitive, but she's also able to crack jokes and kind of alleviate maybe some of the pressure or the tension that might come up when she's talking about it with a date. And Amira may also, practice here and there, talking to people about this, letting them know about this while she's still texting them on the app, or, before she's gotten to know them really well, because she's playing out how it feels to be really upfront about it, or she may wait with, another person to talk to them about it. She's really just kind of testing the waters to see what's most comfortable for her. This other example I gave with Shauna is to highlight how, somebody might approach it differently. Somebody who maybe is a little bit older, who maybe has a clearer sense of what they're looking for with dating, right? In my mind, this kind of example of the Shauna character is somebody who has been through a lot of, dating in the past. She's kind of experienced in it. She knows what she's looking for. Maybe she's looking for a serious partnership, looking to get married and have a family, and that's something that's really important to her. And because of that, she feels more comfortable sharing more upfront, right? So I also kind of, put in this example that maybe she's about to start treatment, right? So she's still dating, even though she's about to start, let's say, chemo. I threw in this piece that maybe she's, undergoing some fertility treatments, because that is such a sensitive and intimate thing that women in particular might be dealing with. And I wanted to kind of set the stage for us to talk about that in a few more slides. So for Shauna, it benefits her to be really direct and straightforward and kind with dates about the fact that she's about to start treatment, because that's going to affect, her dating life. If she's not feeling well for a few weeks, she wants them to know. If she's, unavailable because she's focusing on her health and her treatment, that's important for a new partner to know about. And it also gives her the opportunity to see how that person responds when she shares with them that she's going through this. It gives her a chance to see, how are they responding to this? Are they understanding? Are they kind? Are they totally freaked out and scared? And that gives her the opportunity to make a choice about whether or not that person's the right fit for her at this time in her life. So now we're going to get into talking about specific issues that might be, relevant for you when it comes to dating. I think the biggest issue that we hear about with our patients is just coping with the fear of recurrence, right? So if you're somebody who is done with active treatment, you're in survivorship, you might be wrestling with the fear of the cancer coming back, and that might really take up a lot of space in your life. And so, we want to make space for the fact that that might be something that you want to share with a partner, right? So if you're starting to get to know somebody and this is a really huge part of your life, of course, that might be something that you want to talk with them about. For the same reason too, if you're looking to date a person with some intention of like a serious partnership, you might be looking for a person who can help you cope with that, right? Somebody who's along for the ride with these kind of concerns and anxieties in your life, just like you might want to be along for the ride with whatever their concerns and anxieties are in life. It's really important to kind of feel comfortable, I think, being able to talk about any additional treatment that might be ongoing or that might happen in the future if that's the case for you. So kind of referring back to the Shauna example, she's about to start treatment. It would, for her, be really important to share that with a potential partner so that they're aware that that's a huge part of her life. And that might really impact, the dating relationship. We're going to talk a little bit more in the next couple slides about how to address concerns about physical changes and sexual intimacy. That is a huge, huge, huge topic and so normal for so many of the people that we work with. So if that feels like that's ringing a bell for you, you're not alone. Finally, fertility. Again, I kind of, with that Shauna example, threw this in because for a lot of women, this is a reality, right? Your cancer treatment may have affected fertility, and especially if that is something that is important to you. And when it comes to dating, you're looking for a partner that someday you'd like to have children with. Being able to talk openly about this with them is important. And this, because this can be such a sensitive and intimate issue, this might not be something that you want to share right away. It might be something that you wait until you've built some level of trust and intimacy with this person to talk about with them, right? And then this kind of goes for anybody in the dating world, whether or not you're kind of dealing with issues related to cancer. It's really important to talk about your feelings around dating and what you're looking for in a partner. And Julia and I will both encourage you to talk about this kind of up front, right? So be really honest with the people that you're going on dates with about what you're looking for. And that really kind of starts with doing the work for yourself, really understanding, what is it that I'm looking for here? Am I looking to just get back out there and start dating and see what happens? Am I taking this really seriously and I'm really intentional about dating and I'm really looking for a partner? Am I looking for just something casual and fun, as a healthy distraction from these other stressors I have in my life right now? It's really helpful to understand that for yourself so you can communicate it. And we really want to highlight that you remember that you are worthy of a loving and caring partner who respects your needs and boundaries. Right? So regardless of what those needs are, regardless of the boundaries you set, you are worthy of somebody who's going to respect and understand that.
So as Maddie said, we really do want to highlight and address the impact that cancer can have on sexual health. And the changes that can occur with your body and sexuality. And as we think about dating, how impactful that is, and whether these changes may be temporary or permanent and may have multiple causes. It's very clear that it can be triggering as we think about dating and can bring up anxiety, can cause you to be uncomfortable in your body, can make you feel self-conscious as you think about becoming intimate with a partner or potential partners when we think about dating, and which is it could be a leftover scar, so to speak, from your cancer experience and the side effects that are left. And we know this is real, and we want to speak to that about how important sexual health is in all of this, and to be comfortable with that. And as you are starting to explore dating and exploring sexuality and your ideas for being intimate with someone, and what that looks for and what you may have wanted and experiences that you may have not been able to have because that was paused due to treatment, it's really important to have that come up too as you're creating this canvas of dating And along with that, to recognize that things may have changed in your body as you're experiencing that. And if something isn't comfortable, to not be okay with that and to advocate for what you need. So whether it's advocating to a new partner or advocating to your medical team and bringing up these health concerns. And as we've talked about, whether it's due to a medication, whether it's hormonal treatment that's causing vaginal dryness, or whether it's, you're now having erectile dysfunction due to the fact of so much chemotherapy and treatment, what interventions can be taken place on a medical level to support you in reaching pleasure and enjoyment, and to alleviate some of this unwanted anxiety and some feelings of self-consciousness and not being comfortable in your own body and your own skin. And what else can you do to seek that comfort and level of and feeling comfortable with sexual health and your own sexuality and finding that? And so we do encourage speaking with a therapist and getting referrals to whether it's a sex therapist or a pelvic floor therapist and things like that as you continue. And I think they go hand in hand. And Maddie's going to talk to some more great tools and interventions to help as you explore this. But we really want to recognize how important it is to also bring these up to your primary medical team as they come up.
And so we recognize like this can be a really difficult topic to talk about, right? We're lucky in that Julia and I are able to talk about this in a therapy setting, and that that's a space specific to talk about really vulnerable and intimate things. But we just want to honor that this can be something that can, for some people, be really difficult to talk about, really difficult to confront within yourself, and especially difficult to talk about with a new partner. So just kind of laying the groundwork for that. But we do want to say communication about sexual desires and needs and concerns is necessary in any relationship, right? So regardless of cancer, this is something that we encourage you to think about, how you talk about a partner with your sexual needs anyway. And to think too about, opening the conversation to your partner, what their needs are as well. It can take the pressure off of you. So we really, really want to start with highlighting the fact that you can begin on your own, exploring what your desires and your needs and your concerns are when it comes to sex and sexual intimacy and sexual health, right? So, and that's doing kind of the work on your own to explore for yourself what the issue is and even what the solutions can be, is going to help set you up for being able to communicate more effectively to your partner about how they can help meet your needs, right? So if you go into a conversation with a new date or a new partner about kind of the specifics about what might be going on for you, but you have things to offer. For example, you might say like, sex has become a lot more difficult for me or a lot more painful for me because of the medications I'm on. So that means it might take me longer to feel ready to have sex with you, right? That might mean I need to kind of like either get to know you better first, or we need to kind of do other things before we get to that level so that I can feel comfortable, so that it can be enjoyable for me, right? That way it's really clear that you're communicating not just the issue, but also solutions to the issue. And that's going to help your partner feel more confident in meeting your needs. Okay, great. So if, you're interested in wanting to have sex, but it's just going to take a little bit longer, or it's going to take more of this or more of that, I'm on the same page and I can meet those needs. Or if they can't meet your needs, then they can tell you that they can't meet your needs, and then right? And that doesn't have to be taken as a rejection. That can just be taken as information, right? So a good way to kind of start when it comes to actually communicating with a partner is, it could be helpful to start by writing down some of your specific concerns ahead of time, talking about it with a friend first, talking about it with your therapist first, just to kind of really figure out what it is that is the issue. Being able to pick a low stress time and a neutral setting to talk about this with a partner. So you're not waiting till you're kind of in the heat of the moment, although of course that can happen. And that's not the worst thing, but if you're able to kind of be more in control of this conversation, it can help you feel more confident when you have it. I went over, being able to be honest about potential problems and share how you might be able to address those problems. And then really giving your partner a sense of what helps increase your pleasure and decrease your discomfort. Okay, this is my favorite slide. Julie knows this. Replace fear with curiosity. This is like my go-to key phrase for everything in life, right? It's applicable in all areas. So I hope that you're able to carry this with you even beyond the dating, scene, to be able to recognize when a lot of the thoughts that you're having are fear-based thoughts, to pause and ask yourself, okay, how can I think about this in a way that's actually, in a framework of curiosity? How can I think about these things in a way that, it makes me feel love for myself? How can I be more exploratory with these things? So a good example of this when it comes to sex might be, the thoughts you might be having around sex could be, what if it's really painful? What if it's really uncomfortable? What if it's awkward? What if they don't like me? What if I'm not good enough? What if, all these what if questions that come up, and I'm sure have come up for many of you. Just taking a deep breath and pausing and asking yourself, well, how can I replace those fear-based questions with curiosity and exploration? What if this is an opportunity for me to explore what feels good? What if this is an opportunity for me to find connection and closeness with my partner in a different way? How can I enjoy non-sexual physical touch with my partner? How can I enjoy other areas of sexual intimacy that aren't specifically sexual intercourse? How can I figure out what I like and what I don't like, right? So it's just by flipping the way you're asking yourself these questions, you can tell that it's much easier to kind of cope and handle those things. Yeah, I really like the question, asking yourself, how can this be more fun for me? Dating can be extremely stressful. Asking yourself, well, but how can this be fun for me? How can I be open to this? How can this be exciting for me? What do I need to make that happen, right? How do I practice sexual exploration and pleasure on my own? I kind of touched on this in the last slide. We really encourage you to figure out things that you like and don't like, things that work for you and don't work for you on your own. That's the best place to do it, right? You're by yourself. There's no judgment. There's no pressure. It's just you, and you just get to figure things out for yourself. And that's going to help you when you actually are participating, in things with a partner or partners. And then, are there specific desires, likes, or dislikes that I'd like to explore on my own or with a partner? So asking yourself openly, like, what are the things that I'd like to try? What are the things that are exciting to me? What are the things that I definitely don't want to do, right? And having a clear sense of that is going to help you feel more confident when it comes to sex with a partner.
Thank you, Maddie. So we've covered a lot today, hoping that we shed some light on preparing you to be the best version of your 2.0 dating self. And we want to leave you with, most importantly, to remember to have fun with all of this. And hopefully we gave you some things to really reflect on as you think about going out there and start dating, and some questions to ask yourself of what you want from dating right now, how you envision dating to be, what you want in a partner, what you're ready to take on with dating. And remember that you can take breaks. You might start dating and it may feel great, and then there might be a date that doesn't feel so good, and it's completely okay and healthy to take a step away and continue to reflect and think about what the next steps are for you in this journey. We encourage, as we said, to confide in friends and practice some of these interventions and tools on continuing your narrative and sharing what that would look like in telling an intimate partner or companion. And most importantly, to be true to yourself and authentic to what this is, and not lose sight of that. And it's so important to have boundaries and never feel pressured to share anything about your cancer experience, and only answer questions that you're comfortable in disclosing at a time that feels comfortable. And please find support, whether it's support in your support squad of friends and families. Seek help from professionals such as Maddie and myself and a therapist to help you through this. And before we go to Q&A, we just want to close with this quote And I think that it's just important to leave with that relationships, it's more than just the dates, holding hands and kissing. It's about accepting each other's weirdness and flaws. It's about being yourself and finding happiness together. It's about seeing an imperfect person perfectly. And so to remember that, Maddie and I are that's our contact information. And I believe this is being recorded, and so you'll be able to find it online as well. I'm gonna stop our share now so that we can go to some of the questions that I think are starting to appear in the chat.
Thank you so much. That was such a wonderful presentation. I just entered both of your emails. Oh, it looks like I sent it to panelists only. I will re-enter both of your emails into the chat room so you'll have that information. And yes, this is being recorded, so it will be up on our video library in about a month. You can also rewatch it at any time on our Facebook Live, since it has been live streamed there. And as we let a couple more questions come in, you're welcome to enter them into the Q&A feature at any time. I'll also mention that we have some wonderful support at Cancer Support Community Los Angeles. For those of you along your cancer journey, we have a wonderful young adult support program, a post-treatment support group, as well as many other social activities where you are welcome to come and meet some other cancer survivors or people impacted by cancer. But I will go ahead and read our first question. Said, you had mentioned that the study mentioned bringing up cancer after X number of dates. Could you touch on that a little bit more?
Yeah, so I just saw from that article that they had highlighted that most participants responded that they would prefer to hear about their partner or their date's cancer experience after a few dates. So I'm imagining a few dates is 3 or 4. Right. I didn't really see much beyond that, but my interpretation of that, just from, talking with people about this kind of stuff, is that I think for somebody to hear more about something so personal and intimate, it would feel more comfortable to kind of talk about that more in depth after you kind of have gotten to know the person for a few dates. But again, like I said, when I was bringing that up the first time, I don't think that needs to be an indicator for you that, okay, then I shouldn't talk about this until the 4th date. It really is up to you what you feel comfortable with, and really kind of reading the date that you're on or the person that you're with, what you think they're going to feel comfortable with hearing, how you want to decide when to talk about it. And like I shared with that example, the Amira example, she played around with letting people know even while she was texting them on the apps, right? So that might come up in conversation while you're talking to someone before you even meet them. I mean, there's really no right or wrong way to do this.
Yeah. And I'd like to just add that I once had a patient share with me that it was kind of she realized that after being in the medical system for so long, her narrative sometimes became medicalized in the sense that, especially at UCLA, where we're a teaching hospital, it became so easy for her to just have her narrative roll off her tongue and share so much medical information about her cancer diagnosis and her story and all of her ER visits and all the gory stuff, that when she did start to approach the topic of dating, she realized that she really had to be, curate her narrative a bit, that it wouldn't be normal for her to just on a first or second date share with someone such a complete medical history. And even with someone that she wanted to invest a future with, she wanted to be very careful how she shared that information. And it became too natural that she was so comfortable just letting so much information and, roll off the tip of her tongue. And so I think that also speaks to a bit about what this article is sharing, that for this patient that I worked with, she really realized that she wanted to make sure that she was catching someone at an appropriate time. She wasn't making it sound so casual, because their reactions could be also, if it is so casual, what does this mean for you right now in your life? And things like that. And so it made her stop for a second and recognize that she needed to create a little bit of a narrative, skim down her narrative and what was important for that person to hear in the moment that she's potentially wants to create a partnership with.
Yeah. Yeah, and I'll just add a little bit more off of that too. It's something that Julia highlighted at the very end of our talk, but you can always start with less is more. You can always start with just bare bones. I had this diagnosis at this time of my life, and really kind of basic information, and you can see how the person asks you about it, and you can go from there. And like Julia said, you don't have to answer every question that somebody has. If they're being really intrusive, you can simply tell them, like, thank you for caring and wanting to know, but I'm not ready to share all that with you. Or if that's easier for you to kind of start with something really kind of minimal about your experience and let them ask questions, if that feels more comfortable for you, then you can go that way too.
Thank you. That was a wonderful and really thorough answer. It sounds like, flexibility is really key in this process so much, and following your own intuitions and feelings. So that's a wonderful answer. It looks like we have another question. In the current social climate and this moment in our pandemic history, where and how would a 34-year-old, as this person called themselves, stork, look for dating opportunities?
Well, I think that everyone is trying to re-enter the current social climate, regardless of a cancer diagnosis. But I think that many people do turn to the apps right now. And in some ways, I think with a cancer diagnosis, there is a safeguard to that. You get to control who you might be interested based on what they list as activities they're interested in, where they live. So, how far are you willing to travel to meet someone for a cup of coffee or a walk in the park? So controlling how much you want to. You can also always say, like, oh, it's been really nice exchanging a few texts. Maybe we can start with an old school phone call or a FaceTime or something like that. I think that there are different things are popping up this summer in terms of joining like a tennis league or a softball league, or meetups like that are starting to reappear. So I think that's a way. You, as a 34-year-old, you're still part of the AYA community. And there are tons and tons of meetups, either through like UCLA has a very big AYA program, but just even nationally, like Stupid Cancer to mention some. If you want to stick in the cancer network, I always think about, instead of going out with the idea of dating, think about just looking to make social connections. So where's a place where I can practice just meeting people and getting to know others, and what would that lead to? My intention is just to go out, put myself out there, get dressed, not be wearing athleisure clothes that we've all been wearing for the last 16 plus months, having to put, do our hair, put makeup on, and, put away our, yoga pants or joggers. And where is a place where other people are going to be? So whether that's a cancer meetup, or is there a hobby I have? Things like that, a hiking group, similar to that. And then the dating could be the second thing on the agenda.
Yeah, and I see the second question is, what is AYA? AYA is adolescents and young adults. So that's our population, well, Julia's population for sure. And I also work with a lot of adolescents and young adults. So that's what she means when she says AYA.
Right. Sorry. And it goes up to age 39. So it's a very large, it starts at 15 and goes up to 39. And the National Cancer Institute and NCCN are all encouraging that large cancer hospitals and institutions have identified support programs that address similarly these dating challenges, and other, recognizing that young adults want to live these healthy young adult lifestyles, and that dating is a challenge in itself, cancer or not, and recognizing that there might be these added challenges.
Thank you. Absolutely. Here at Cancer Support Community, we consider AYA 18 to 40. So we, from time to time, have programs. I know we have a now monthly young adults trivia night and game night that we're holding. So you can join things of that sort. But I do also want to mention that we understand that dating is not only for those between 18 to 40. We know some of you out there are, in the higher age range. And we also have living alone with cancer support groups. So a little more geared towards those who are a little older in life and living alone. And, this might apply to you as well. So there are many options out there aside from the AYA programming. Thank you so much again for being here with us. It has been such a pleasure. This topic was requested by our community, so I hope they got some really good information. Again, this will be up on our website video library in a month, and it is on Facebook Live for you to rewatch again and again. And thank you so much, Julia and Madeline. We hope, one day we get to do this again in person. But until then, thank you so much.
Thank you.
Thank you.